Important case based learning will start today is actually, so let's start it. Bismillahirrahmanirrahim. So in front of you you have a case based presentation, okay, in which they are saying the 45-year-old man which is completely well but 8 months back developed a weakness in the lower limb with muscle wasting and twitching. Months later, he noticed difficulty in gripping things, followed by difficulty in swallowing nasal speech. Means the patient cannot hold, cannot swallow, and the nasal speech is also difficult. On examination, uh, uh, there was fasciculations in the lower limbs, but at the same no sensory loss. But there is no sensory loss. So basically, it is a classical scenario for the motor neuron disease. Okay, now moving towards the head, you can see here this patient muscle wasting. Okay, what is motor neuron disease? Again, it is also a progressive disease like multiple sclerosis of unknown etiology. There is a axonal degeneration of the upper and lower motor neurons. There in remember in multiple sclerosis there was actually demyelination of axons, but here the axons are degenerating of the upper and motor neurons. Okay, now classification is into three types, although there is no often some overlap, but amyotrophic lateral sclerosis is 50% affecting the corticospinal tracts, predominantly producing spastic paraparesis or tetraparesis. So the amyotrophic lateral sclerosis is basically another name for the motor neuron disease. Okay. Then what is means by paraparesis and tetraparesis is basically paraparesis is basically the paralysis of lower limbs. Okay. But tetraparesis is basically means the paralysis of the four limbs, means your upper and your lower both limbs are paralyzed. Okay, now moving towards another type. First we studied about the eight amyotrophic lateral sclerosis. The other type is basically progressive muscular atrophy, which is 25%. Okay, means there is actually progressive atrophy of the muscles affecting the interior horn cells, predominantly producing wasting, fasciculation weakness, and best prognosis it has. But progressive bulbar palsy, which is 25%, affecting the lower cranial nerves and suprabulbar nuclei, producing a speech and swallow problems. In upper, there were the problems of wasting, weakness, and fasciculations. But here the problems are speech and swallowing, so it has a very worse prognosis. Okay, now here remember the patient has paralysis of the lower limbs or the forelimbs. But in the progressive muscular atrophy, there is a atrophy, so means you can remember by wasting of muscles, so there will be weakness. In bulbar paralysis, you remember it by speech. There is actually speech and swallow difficulties. Okay, now moving towards